today. My name is Carolyn Hornbuckle. I work at the National Indian Health Board, where I have a dual role as the COO and also the Director of Policy. It's been my pleasure to be with the National Indian Health Board for going on almost 9 years now, and our Policy Center is the lead agency in our organization that's been working on this webinar in coordination with CMS. One of the reasons why we are putting on this webinar today is because we know that Medicare, Medicaid, and private health insurance enrollment are critical components of support for the Indian health system. And this has really never been more true and important than right now in light of the extraordinary pressures resulting from COVID-19. In light of this heightened need, the National Indian Health Board and CMS have collaborated to bring you this webinar today with a terrific lineup of speakers. During this webinar, we will aim to provide patient benefit coordinators and enrollment assisters with the tools and information they need to enroll tribal members virtually and by mail during the COVID-19 pandemic. I would just mention to folks, if you can please mute yourself. I think all of our speakers need to mute ourselves. Thanks. Although the webinar has been geared for this particular audience of enrollment assisters and benefits coordinators, outreach and education goes on at every level of our communities. So even if you are not an assister or coordinator, we're certain that the information that we share today will be helpful to you as well. In terms of scope, today's content focuses on best practices, education on enrollment and special changes to enrollment in Medicare, Medicaid, and CHIP, and the marketplace, and especially those changes in relation to COVID-19. After I introduce the speakers, we'll begin our presentations. After our presentations, we'll have a moderated question and answer session. The session will be moderated by NIHB staff person, Kristen Bitsui. Once that panel discussion finishes, we'll open up the floor for questions from the audience, and you can ask questions through the chat box. So I would like to go ahead and just thank our speakers, including Raho Ortiz from IHS, Kitty Marks from CMS, Maureen Manring and Juliet Yazzie from BeWell, New Mexico, and Amina Cogley from Washoe Tribal Health Center. So I'll give you just a little bit about each of our speakers now. So Mr. Raho Ortiz is Director of the IHS Division of the Business Office Enhancement within the Office of Resource Access and Partnerships. He is Navajo and Acoma Pueblo and grew up in Arizona on the Navajo Reservation and in Tucson. After attending the University of Notre Dame and earning his BA in 1990, he earned his law degree from the University of Arizona College of Law in 1993. After graduation, he worked for the Tohono O'odham Nation as their environmental director, and then for the Pasquayaqui tribe as their tribal attorney. He served as a majority and minority counsel to the U.S. Senate Committee on Indian Affairs, after which he joined a law firm, and then worked for the U.S. Environmental Protection Agency before working for the Friendship House Association of American Indians, a residential substance abuse treatment program in San Francisco. He joined IHS in 2007, and welcome to our webinar. Kitty Marks is Director of the Division of Tribal Affairs at the Centers for Medicare and Medicaid Services. And prior to her work at CMS, Kitty was the Legislative Director of the National Indian Health Board. Kitty is a former IHS employee and served as the branch chief of the Policy Liaison Team. Prior to her work at IHS, she served as the managing attorney for the Montana Legal Services Field Office in Browning. Kitty received her Bachelor of Arts in History from the University of Maryland, College Park, and her JD from Vermont Law School. Kristen Bitsui from our staff is an enrolled member of the Dene Nation. Kristen serves as the Tribal Healthcare Reform Outreach and Education Policy Coordinator for NIHB. Ms. Bitsui provides technical assistance, education, and training on the Affordable Care Act, Medicare, Medicaid, and CHIP programs, as well as changes in the Indian healthcare system. She serves Indian country as national advocate on the importance of outreach and education activities at the ground level to drive the Indian health system and connect consumers to better care. Ms. Bitsui previously worked for the Indian Health Service, for 15 years in the business office, the Purchase Referred Care Department, and Health Promotion and Disease Prevention Department. She is a recipient of numerous awards, including the Indian Health Service Directors Award and the Tucson Area Individual Exceptional Performance Award. Maureen Manring from BeWell, New Mexico, is Director of Communication and Outreach. Maureen was born in Fort Sill, Oklahoma, and she's lived in Albuquerque most of her life. Maureen has been in the strategic marketing, communications, and outreach department for more than 25 years. Her areas of expertise include strategic planning, brand awareness, community relations, program and vendor management, sales, service, retention, all within the health insurance industry. She is currently with New Mexico Health Insurance Exchange, BeWell, New Mexico, as the Director of Communication and Outreach. She leads a strategic team of vendors and staff to ensure success of promoting the exchange to New Mexicans, community partners, and stakeholders. And we also will have Juliet Yazzie, also from BeWell, New Mexico, and she is working there as a Native American Liaison Manager. Juliet was born and raised in Albuquerque and is an enrolled member of the Navajo Nation. Juliet has been providing Affordable Care Act and health insurance marketplace outreach, education, and enrollment assistance since 2013. She is certified with the New Mexico Office of Superintendent of Insurance to provide enrollment assistance to the health insurance marketplace. She is also certified with the State of New Mexico Health and Human Services Department to assist with applications for Medicaid. Juliet coordinates with tribal leadership and tribal programs, as well as provides direct outreach to Native American communities. Amina Cogley, and I hope I've gotten that pronunciation right, is from the Washoe Tribal Health Center. Amina works at the Washoe, she has worked at Washoe for the past 9 years, and she started out as a data entry clerk in the third-party billing department. And from there, she moved on to claims processing. She has found her niche in her current position as a patient benefits coordinator. She has experience in billing and coding, Medicare, as well as partnership member and regional state insurance Medicare Assistance Program, MAP program. I think I've gotten that right. As an employee of Washoe, she received a rare opportunity to be the only tribal health clinic in the state of Nevada to participate in the Family Services Special Academy and was graduate of Academy number 61. This is the same academy training that the state of Nevada put their new hires through prior to being assigned as a Department of Welfare, Social Services, Family Services, and eligibility worker. The training she received through the Department of Welfare Social Services Academy has given her great insight of the welfare programs offered in the state of Nevada, which has expanded resources at Washoe's Tribal Health Center. So with that, as a little bit of a background on our speakers, I would like to turn things over to Raho to begin an overview presentation. Raho, please take it away.
Hi, good morning, everybody. This is Raho Ortiz. Thank you for the introduction, Carolyn, and thank you to the National Indian Health Board and to CMS for including IHS on this call and on this webinar. I really appreciate all of you attending and being a part of this. It's an important topic, especially for us in the business office, of course, where my division is, because we're always concerned about revenue and the loss of revenue because of COVID and where we go from here. So I just wanted to give you some remarks that after speaking with some of our staff here and talking with people in the field, we also keep in regular touch with our areas in terms of our collections during COVID. We track our revenue on a weekly basis. With the tools here at headquarters. At the local level, they have the ability to, because they have access to their particular Resource Patient Management System, RPMS system, there locally, they're able to get more and better data than we are. But from what we're able to see at headquarters, we do follow up with the areas on those, and we do ask them specifically about enrollment and about what they're seeing. So as Carolyn said, and we can't emphasize enough that enrolling patients and making sure that they stay enrolled in alternate resources is more important now than ever. Because of the risk of COVID and the complications associated with that, we need to make sure that our patients have the safety net to fall back on, and that they can take that insurance and use it wherever they may need to for services. As I said, the third-party resources are affected, of course, by our enrollment numbers, and we have already been tracking our own data. Although we do see that it comes from our losses come from several sources, not just enrollment, but also from the fact that we've had to implement safety precautions in all of our facilities in order to make sure our patients are safe and our staff are safe. And so this has, of course, reduced foot traffic and made it difficult to reach people that way face to face. But we still, when people still come into the clinic for necessary procedures or necessary appointments, we do take that opportunity when we can to have staff available to enroll them. As I said, our revenue, has decreased, and because of outpatient visits as well as enrollment, and we've been tracking that information too, and speaking with the areas about it. Technological challenges are also a factor, in having to now use the telephone or use video conferencing capabilities, where it really kind of goes area by area and service unit by service unit. Some of our areas have implemented telemedicine, and where they're able to implement telemedicine pretty well, they've also made provisions for, in some cases, for patient benefits coordinators to communicate similarly with our patients. But in other cases, because of the lack of connectivity in the area, and also patient resources to have cell phones or to have smartphones or to have tablets, that's always that can be a barrier too, even to making a phone call. So we have to work with that. As I think was mentioned before, some of the alternatives that we've taken in order to reach our patients, of course, as I said, virtual and telephone and by mail, it can be really dependent on in some cases, say for Medicaid, on the state, whether the state allows requires a wet signature or not from a patient. So our PBCs really have to kind of know the rules in order to make it work for our patients. When it comes to renewals of Medicaid for our patients, that's also been something that we've been tracking. We asked our patient benefits coordinators to make sure that they're following up with patients to make sure they don't miss that. And I would say also that whether there were in talking with our patient benefit coordinators and talking with our staff, a couple of the interesting things that we found out are, one, that in terms of attitudes of people or willingness to enroll in alternate resources and health insurance, we found that people in general seem to be more willing, the ones we've been able to contact, and particularly if they or someone in their family has been affected by COVID. We find that people seem to be more open and seem to recognize the value of it, and want to answer all the questions and sit on the phone and walk through the applications. The other interesting observation is that our data, our contact information, for our patients with phone numbers, emails, and mailing addresses, they also are we're getting better and validating that information a lot better as well. We think because people are, in some cases, people are trying to find out their test results, or they just seem to be more, concerned about making sure that they're able to be reached by IHS. So despite the situation that we're currently faced with, we do see a couple bright spots. Now, I guess in general, in speaking more generally, and to wrap up my comments, I want to say that the IHS is continuing to seek partnership with tribes and with tribal organizations to make sure that that we're not letting people fall through the cracks, that our patients, wherever they may go for their care, are being reached by all of our staff. And I think that really starts with what we're doing today, which is providing information, providing best practices, and communicating. That communication for starting with IHS within each facility is extremely important, because our patients enter our system at different points. And so whomever may come across the patient, whether it's patient registration or PRC, and they can see that the patient does not, or they see that the patient does not have an alternate resource, that communication within the hospital or within the clinic is really important to make sure that we're addressing that right away. And then further following up with our partners, of course, with CMS, when we do have questions, and we want to make sure that we're getting the technical assistance we need. So I didn't want to take too much time. I'm sorry I won't be able to join the second half of the call, because I have to join another meeting. But I really appreciate the opportunity to be on the call. I will stay a few minutes, and if you do have questions, you can ask them or send them by email. It's Raho. It's RAHO .ortiz @ihs.gov. So I'm working virtually. I'm teleworking. And I forgot to mention that as well, is that in some cases, a lot of our staff are teleworking as well. But like I said, we do have staff usually in the clinic at depending on the hours to assist patients. But a number of our facilities, our patient benefits coordinator staff are teleworking and trying to reach patients virtually or by telephone. So that's the extent of my comments, and I appreciate the opportunity. Thank you.
Thanks very much, Raho. We appreciate you being with us, and we will make sure that any questions that are directed to IHS make their way to you. And when we post this webinar to our webpage, we'll make sure that we include, if there were questions and answers for IHS. So thank you for being with us. And next up, we have Kitty. And I think, Kitty, if you just unmute yourself, we'll be ready to go.
Okay. Hi, Carolyn. Can you hear me?
Yes, we can.
Okay, great. I know we have a lot to cover today, but I do appreciate the opportunity to talk a little bit about the Division of Tribal Affairs and the work that we do, especially around outreach and education. So next slide, please. So the Division of Tribal Affairs is located within the Center for Medicaid and CHIP Services, but our office serves as the point of contact on Indian health issues for the entire agency, including the health insurance marketplace, Medicare, and a large portion of our work has to do with outreach and education about the CMS programs and encouraging American Indians and Alaska Natives to enroll in whether it be Medicare, the marketplace, Medicaid, and CHIP. So next slide, please. So I think Carolyn and Raho talked a little bit about the importance of Medicare and Medicaid reimbursements to the Indian Health Service delivery system, but it's really important to understand that this authority for IHS, tribal, and urban clinics to bill Medicare and Medicaid is based on Congress's recognition that the Congress and the federal government has a responsibility to provide health care to American Indians and Alaska Natives. And in 1976, they authorized specific authority, and this authority to bill Medicare and Medicaid is unique to any other federal program. And we know how important the Medicare and Medicaid reimbursements are to help support the Indian Health Service delivery system. And as Raho indicated, especially now during this pandemic, those resources continue to be needed. And so we do want to encourage you, and I'm so glad that NIHB is having this webinar to talk about how to maintain that enrollment during this time period. Last year, IHS received over $1 billion in Medicare and Medicaid reimbursements, and I know that all the local programs receive reimbursements as well and help support the facilities. So next slide, please. And to help with the enrollment into many of our programs, we develop a series of fact sheets and brochures. Several years ago, we held focus groups to test out some of our materials. And we found that utilizing graphics and pictures of tribal beneficiaries and tribal communities help ensure that these materials are relevant and that they will be used. So in developing our materials, they are culturally appropriate and they really are geared to tribal communities to better understand the CMS programs. And all of our materials are available for downloading on our website and can be ordered from our warehouse in Baltimore that still continues to be open. Next slide, please. Recently, we published a tribal calendar. This is an 18-month calendar that started July 1st, 2020 and goes till December 31st, 2021. And this calendar includes helpful information about health information, helpful links to other resources, and of course, with all of our outreach and education materials to encourage enrollment in Medicare and Marketplace. We include the open enrollment dates, and with Medicaid and CHIP, you can enroll all year long. So this calendar is available to be ordered from our warehouse, though I will say that they're going out the door very quickly, or can be downloaded and printed from your personal computer. Next slide, please. And the division publishes monthly public service announcements. These public service announcements run in tribal newspapers and on tribal radio stations. They are available on our website and can be downloaded and used by your particular community if you want to run it on your local radio station. This public service announcement for July was developed in collaboration with Indian Health Service. And kind of to Raho's point, we really want to encourage tribal members to utilize their IHS tribal and urban Indian clinics as a trusted source of health care. Like all providers, they're seeing a decrease in reimbursements because people are not coming into the clinics. But as the COVID lessens in your particular community and you feel comfortable, IHS and tribal urban Indian health clinics are available to help. So next slide, please. So this is our website, particularly our outreach and education resource website. You can see where you can download the public service announcements. And then we have organized all our fact sheets by topic: health insurance marketplace, Medicaid, and CHIP. And so this is a great place to go to find out all about our outreach and education materials. Next slide, please. And we also publish an outreach and education newsletter, and it's easy to sign up, again, on our website. You just go to the new public service announcements and then click on the sign up box, and we will distribute the newsletter to you, and it has a lot of helpful information. Next slide, please. And I know that a lot of you are not in your clinics and you may not be holding outreach and education events, but if you do want to share information about the CMS programs and our fact sheets, you can order through this website link. If you are new, you'll have to go in and create an account, and then you can log on and see all the specific fact sheets. There's a thumbnail so you can see what the product looks like before you order it. It does take about 2 weeks for the materials to arrive, but again, all of the materials on our website can be downloaded onto your personal printer. Next slide, please. And CMS continues to hold its trainings. Usually we hold face-to-face trainings, but because of the COVID, we've had to convert our trainings to virtual trainings. We have organized them by IHS area, and they're held over a 2-week period. And during that 2-week period, we offer up to 14 webinars. And these webinars are for third-party business office coordinators, patient coordinators, enrollment assisters to learn more about the CMS programs. For instance, we have a Medicare 101, Medicaid 101, Social Security benefits. Christian helps us by talking about the marketplace and outreach. And so I really encourage you to go to this website to see when the training for your particular area will be held. There'll be an opportunity to register. You can see the agenda, and that website is updated on a regular basis. In addition, we usually hold face-to-face medical coding trainings, but we've had to postpone those into the next year. And then in addition, we have archived our webinars. In April through June, we held a series of webinars on, again, the Medicaid 101, Medicare Basics, and we've archived those. So if you could go to the next slide. Okay, so these are just some helpful website and web page links on how to access the archived webinars that I just talked about, more information about the trainings that I mentioned, and how to order products. And then next slide, please. So this is our website link. We also maintain a mailbox, and so if you ever have any questions for CMS, you can send your questions to this email address, and we do monitor it. So that's all I have for today, but I'll be on the call, remain on the call, and answer any questions you might have. Thank you very much for the opportunity to present.
Thank you so much, Kitty. We appreciate all the information, and looking at the chat box, it looks like lots of folks are interested in the calendar and some of the other materials. So I know that you shared those links, and we put a couple into the chat box, but also when we post this recording of this webinar, we will make sure that we have those links on the same page, so folks will have a few ways to get at that information. So now I'm going to go ahead and turn it over to NIHB's Kristen Bitsui, who is going to give us a little bit of information and kind of touching on what you just mentioned, Kitty. Kristen really is our lead at NIHB on outreach and education, and she's going to share some of the things that that we've gathered over the years and things that she would like to highlight to our audience. So Kristen, please go ahead.
Thank you very much. And that was really good, Kitty. I'm glad you were able to share a lot of the outreach and education materials with the audience here. So welcome, and thank you for joining us today. Go ahead, next slide. So in this presentation, I'll give you an overview of several different aspects of health insurance and its benefits, as well as the specific Medicaid benefits and protections, We'll also cover the importance of reporting life changes and understanding special enrollment periods associated with different healthcare plans. Next slide. So the Indian health system is very unique. Therefore, a lot of the users of IHS and the tribal facilities are also unique. American Indian and Alaska Native for the longest time didn't know about health insurance. It is good to have a discussion on why they need to enroll. There are many different reasons to why a person needs to enroll into health insurance. Each individual has a different situation. Maybe their child has an accidental fall at school or had to go to ER. Maybe they live outside of the purchase referred care delivery area, or they fell off the parent's health insurance. The main reason why you enroll into health insurance is to protect your family and yourself, especially during these uncertain times. Health insurance can also deliver the peace of mind you may need, along with the financial protection from out-of-pocket medical costs easily caused by the coronavirus. So health insurance also provides access to important prevention services and the quality of care. Next slide. Other reasons to share of why enrolling into health insurance stems from overall health of yourself and your family. It is important to prioritize your health both mentally and physically, and to have access to precautionary services in order to maintain your health. Next slide. As I had mentioned, American Indians and Alaska Natives didn't know about health insurance. It is good to educate what benefits the health insurance covers. Many of your patients and clients understand that if their IHS or tribal facility didn't have the specialty services at the facility, they have to get referred out. Educate them about basic services health insurance cover. Health insurance coverage has become increasingly more necessary during today's reality, especially for those with underlying conditions. To name a few of the topics health insurance covered is like diabetes, pregnancy, laboratory services, or any medical devices that may be necessary for them. Next slide. So it's imperative to know what special protections are available to American Indians and Alaska Natives. One of those protections is the Special Enrollment Period. During these uncertain times, tribal enrollment sisters and patient benefit coordinators need to strategize on how to assist their clients and patients to enroll into health insurance. Educate on the year-round enrollment opportunities in Medicaid and the CHIP health insurance program and the health insurance marketplace for members of the federally recognized tribes. The special enrollment periods for American Indians and Alaska Natives through the health insurance marketplace allows family members of American Indians and Alaska Natives to enroll in health coverage that is outside the normal annual open enrollment period for certain lifetime events. Next slide. As many of you are aware, a majority of American Indians and Alaska Natives qualify for Medicaid. It is good to inform your clients and patients about the different types of health insurance opportunities. They may not qualify for Medicaid, so what other options are available for them? Be knowledgeable about health insurance options. Next slide. Here are some of the specific Medicaid and CHIP benefits and protections for American Indians and Alaska Natives. It is important to understand there are no co-pays, deductibles, and co-insurance premiums or fees for American Indians and Alaska Natives, as well as educating that certain Indian trust income or property are excluded from applying for Medicaid. Next slide. Specific protections for American Indians in the marketplace include the zero-cost sharing plan, where those who are enrolled in a federally recognized tribe receive no co-pays, deductibles, or co-insurance when receiving care from the Indian health service providers or other qualified health plans. Individuals must receive income between 100% to 300%. This plan also allows for no referral from a provider when receiving services through the ones that they qualify through this plan. Next slide. Another plan offered through the marketplace for American Indians and Alaska Natives is the limited cost sharing plan, which may look similar to the zero cost sharing plan, but pay close attention to the income levels. And for the limited cost sharing plan, a referral is needed from an Indian healthcare provider. Next slide. In today's changing times, it's important to report life changes, whether it be Medicaid, CHIP, or the marketplace health insurance. It may ultimately be the advantage to report those changes. So for example, it can decrease the premium for someone that's on the health insurance plan in the health insurance marketplace. Such life changes may include losing a previous health insurance, maybe from a recent job. Some other changes could include a change in household size, an adult child losing coverage from their parents' health insurance, newly released from incarceration, or maybe there's a plan change. For more information on reporting changes, please follow this link below. Next slide. Here are a few other examples that would be important to report. These include changes in income, becoming a new parent, change in location, maybe you moved out of state, marriage, loss of family member, to if you have a newly retired individual in the household. It is an important step that you need to share with your clients and patients. It is important to report life changes because it can impact the health coverage or the amount of the premium tax credit and the cost sharing reduction for the marketplace plan, or a new family member can make a family eligible for Medicaid too. Next slide. Another exception for American Indians and Alaska Natives would be the Special Enrollment Period. This allows American Indians and Alaska Natives to enroll into Medicaid and CHIP at any time during the year, while those applying for the marketplace can also enroll at any time throughout the year. However, non-American Indians and Alaska Native family members can also enroll in or change plans through this special enrollment period as long as they are on the same application. Next slide. Data can also be helpful to identify enrollment trends in your area. It will provide important insight on how to approach outreach and education for your clients and patients. If you can see how many American Indians and Alaska Natives have lost their job in your area, you can understand the need for the enrollment campaign for that group of individuals. In the next few slides, I will show how data can help you identify what is happening in your area regarding health insurance enrollment. Coronavirus presents significant health risks in American Indians and Alaska Natives because they face large underlying disparities. Next slide. So when you look at this chart, sorry if it's too small for you to see, but this chart shows the COVID-19 cases for American Indian and Alaska Natives. The reason why I wanted to show you this data is because of what's happening in your state. This will determine which group of individuals you may focus on for enrollment. So, for example, if we take a look at Arizona, there are 7,400 COVID cases. This tells you that unemployment rate most likely increased at that state. Depending on the job of the individual, if the individual tested positive for COVID, the individual may end up losing their job because they have to quarantine. So it just depends on what the job situation is. So as an enrollment assistant and a patient benefit coordinator, you automatically start thinking of where you need to put your enrollment efforts. So it's good to look at data to determine that. Next slide. American Indian and Alaska Native are disproportionately impacted by COVID-19. In recent data, it can be seen that American Indians and Alaska Natives make up 40% of cases nationally. So because of this, it is imperative that individuals become insured during this time. Ultimately, it will allow for more funding for their local Indian Health Service facilities. Next slide. So this slide, it shows you the estimates of how many uninsured American Indians and Alaska Natives have increased due to the COVID-19 job loss. It is an estimated total of 193,101 nearly uninsured. So it's really important to look at this map and look at the state that you are representing and compare what those numbers are. And this is how you're going to be able to look at some of the data and what you need to do and be able to look at some of the patients or your clients of, who's losing their jobs and if there's a reason why they need to get onto maybe a Medicaid because there's no income coming in. So it's really good to look at this map and see what's going on within your state. Next slide. Okay, so let's see, did you miss? I think you missed a slide. You skipped 2 slides right after that one. There we go. Okay, so for New Mexico, enrollment data on the uninsured American Indians and Alaska Natives due to the job losses since the start of COVID-19 pandemic. So this slide shows the uninsured data for the state of New Mexico. According to the May 2020 unemployment data, you can see 11,022 of American Indians and Alaska Natives in New Mexico who have lost their jobs and become uninsured during the COVID-19 pandemic. Right below that number, you will see 6,503 of the newly uninsured will be eligible for Medicaid. In the marketplace world, 24,000 will be eligible for tax credits, but so far experience shows only 25% of the American Indians and Alaska Natives eligible will enroll. So about 634 will be eligible for tax credits. As you can see, data helps you with where you need to focus on health insurance enrollment. Next slide. So NIHB also has some great toolkits located on our website to give individuals, to give them more information for either the elders, the youth, and there's also an enrollment toolkit. And if many of you have been to some of the CMS ITU trainings, we share a lot of this information there too. So take a look at our website. And the next slide. And next slide. And as Kitty had mentioned, she went over all of the CMS outreach materials on their end. So go to their website and order them. And it's really good to get as many as you want. They don't put a limit on it. So you can, but the other thing to always remember about ordering from CMS is that you need to order ahead of time. It doesn't come right away, especially in the rural areas. So keep that in mind. Next slide. So here are some contact information for those who can help you with questions and issues you encounter. You have your CMS Native American contacts who are assigned to each state, as Kitty had mentioned. What I want to point out about the Native American contacts is they provide technical assistance on CMS programs that are specifically to American Indian and Alaska Natives and work on Medicaid tribal issues, as well as Medicare and the health insurance marketplace. Next, you also have the state Medicaid tribal liaisons. If you have a good relationship with them, if you don't, get in contact with them, get to know who you can, that will be able to help you at the state level. And then you can also email Indian Health Service and share information, or if you have any questions at all. Raho had left his email on the chat box. And then there's also, they'll be able to answer any of the questions there. So next slide. And the other thing I wanted to share with you is CMS had released a final letter to issuers on the federal facilitated marketplace. And So this is a sample of the summary of benefits and coverages for zero and limited cost sharing plans for American Indians and Alaska Natives. And as you are helping your patients or your clients who are interested in the marketplace, it's always good to share that summary of benefits that is specifically for American Indians and Alaska Natives. Next slide. And so I get a lot of calls on a daily basis from individuals like yourself asking for COVID-19 related resources around health insurance, whether it be Medicaid, Medicare, or even the marketplace. So our people are asking more questions and wanting to understand their health insurance. So some are starting to even ask, you know, what does my Medicare pay for? Or I heard that I still have to pay a bill if I have health insurance. Or maybe they hear something on the TV or on the radio that is for the general population, and they say that, you know, even if I get on health insurance, I was told that, you know, you still end up getting a bill from the hospital. So different questions like that. So it's really good to be able to learn about some of those things. And our population is unique, and the American Indians and Alaska Natives need to know that they have special protections and provisions in Medicare and as well as in the marketplace health insurance. Next slide. So here are some links you can follow to report life changes in the marketplace. And just go ahead and read up on that, and those are just resources I wanted to share with you on that topic. Next slide. And then so we have the Special Enrollment Period resources that would be beneficial in navigating for the eligibility side of it. So go ahead and go to the next slide. So these are just a lot of resources for you and links that I put together so that you're able to help your clients or your patients as you are assisting them. And here's some more resources on job loss and salary reduction, and if, you know, some of those patients get furloughed or anything like that. So these are some good links to read up on and get educated on your end. Next slide. And then here's more resources for you to look up, from frequently asked questions to toolkits to fact sheets from different states to federal agencies. As a patient benefit coordinator and a tribal enrollment assister, you need to equip yourself with all the knowledge around health insurance marketplace or health insurance information in this COVID-19 environment. The tribal enrollment assisters and patient benefit coordinators need to know the most current information so you can help your clients, patients, and your tribal community. So these are a lot of the resources that I wanted to share with you, and I always get the question of, you know, how do you know this stuff, Kristen? Where can I look to be able to read up on it so that when patients come to me, I'll be able to have that knowledge as well. So these are some of the places where you'll be able to learn a lot about what is happening. And next slide. So I just want to thank each one of you on the call for all the work that you do as you're educating your tribal members about the importance of health insurance. And this is my contact information if you have any questions at all. And that is the end of my presentation right now, and we'll hear from two great speakers next. Carolyn?
Thanks so much, Kristen. We really appreciate you sharing all of that information. You packed so much into all of your slides. I do see people asking in the chat box about whether or not the slides will be made available, and yes, we will definitely make all of these slides available and post some links. If folks have mentioned links that are not in the slides, we'll make sure that we get those links up on our website as well. And I also see a lot of other questions and comments coming up in the chat box. And I do want to let folks know that we will get back to those questions when we get to the question and answer portion. So just hang in there. We'll get to those pieces. But now we're going to hear from Juliet and Maureen from BeWell, New Mexico. And we're going to switch gears just a little bit and kind of hear what the work is looking like on the front lines and some of the best practices that BeWell, New Mexico has really been putting in place. And then from there, we'll switch to Amina. But please, Juliet and Maureen, we'd love to hear from you. Thank you for being with us.
Well, thank you so much for having us today. Dominique, I'm trying to share my screen here, but it's telling me that the participant screen sharing has been disabled.
Sorry about that, Juliet. Do you see National Indian Health Board 2? Or I'm sorry, just National Indian Health Board.
I see that on my screen currently, yes, but whenever I hit share screen, it just states the host disabled participant screen sharing.
Okay.
Hey, Juliet, try it one more time for me, please.
Okay. All right, there we are.
Sorry about that.
No worries, no worries. Thank you. All right, so here we are. Today I'll be providing some information on BeWellNM for Native Americans and what our Native American program is working on here in New Mexico. All right, so for outreach and enrollment, BeWellNM for Native Americans, we do send out a newsletter, which is quarterly. That newsletter has information in regards to our upcoming outreach and enrollment events, as well as information on providing enrollment assistance and how to become an assister. So if you'd like to register to receive our newsletters, you can send us an email at nativeamerican@nmhicks.com. And there on the right-hand side is just a little preview of one of our newsletters that went out this past March. All right, we've also done some outreach to Native American owned small businesses. So we've reached approximately 150. We began with calls, which were started in December of 2019. So we're working to set up a presentation or a meeting to discuss benefits for employees at each location and which enrollment process would work best for each employee, whether that's through our small business health options program or through the individual health insurance marketplace. And so follow-up letters and information packets will be sent on an ongoing basis. We launched a peer-to-peer text campaign, which had over 5,000 mobile phone numbers from an Express Native American list. And so our Native American enrollment counselors were able to text directly to Native American mobile phones. And any responses will be directly from a Native American enrollment counselor. So it creates more of a direct conversation, and we're able to get hone in on those questions that individuals that have and try to get information as to what barriers they might have as to why they're not currently being enrolled, and just again answer any questions that anybody may have. And we also launched an auto dial campaign, and that was for over 1,000 landlines here in New Mexico. And so that auto dial campaign was directly to Native American landlines, and they were also able to receive a response directly from a Native American enrollment counselor. So both of those campaigns were very great. We're trying to, like I said, hone in directly on the Native American population here in New Mexico to try to increase enrollments and make sure that we get any and all questions answered. We do know a lot of individuals do rely on IHS, and so we try to let them know of the benefits of enrolling in a marketplace plan and how a marketplace coverage can complement coverage that is offered through the Indian Health Service areas. So those are two campaigns that we're really, really proud of. All right, so our Native American Advisory Committee. So our Native American Advisory Committee meets quarterly. We did include a calendar, which includes all of our advisory committee dates for the entire year. And that calendar was sent out with our recruitment letters. And our next Native American Advisory Committee meeting will be held on Tuesday, September 1st. Our latest meeting, we did have some good conversations in regards to developing new marketing materials, as well as possibly hosting a webinar that's focused directly on Native American benefits through the health insurance marketplace for the state of New Mexico. So those are some things that we're currently working on, and we'll go ahead and discuss at our next meeting on how to move forward with both of those processes. All right, marketing. And so for marketing, we had developed a few new marketing materials. So this here is our rack card. It's a front and back piece, which includes key facts and ways BeWellNM can be contacted. And so this has been a really good piece. It's a really small, like brochure size piece, and we're able to leave that at community centers, IHS facilities, out here at the Tribal 638s, as well as just to try to get as much information in the hands of New Mexicans and Native Americans. We also developed a leadership brochure. So this was sent out to the tribal leaders here in the state of New Mexico, to the governors, as well as the presidents here in the state. And so it is a full six panel brochure, which includes a fact sheet with the 10 essential health benefits and information on BeWellNM for Native Americans. And so all of our marketing pieces are available on our website at BeWellNM.com/Native American/partner-resources. And this here is the inside of that leadership brochure. So as you can see, it does have a page of frequently asked questions there. And in the middle, we actually provide an example of what a zero cost sharing plan would look like. And so I do apologize on here. It's a little bit smaller there, but it just shows how if an individual enrolls in a plan and they do qualify for zero cost sharing, it just shows that there is no deductible, no out-of-pocket maximum, no co-pays for emergency rooms, generic prescriptions, and things of that sort. And then here on the right, we do have an IHS versus QHP covered services comparison chart. And so that has been very helpful. There are some services that are not available through IHS, such as here in the New Mexico area. Most IHS facilities do not have emergency room services or urgent care services. And so we just really try to emphasize that if you're, say, traveling or maybe on travel, visiting somebody outside of your normal IHS service area, that you can still receive these, that you could still receive these services here outside of your IHS service area. So it is a really, really good thing to have, as well as IHS, because IHS is great. IHS is great, but we do want to inform individuals that these are just complements to your IHS coverage. And if you're traveling out of state, for instance, and you're outside of your IHS service area, then your qualified health plan could then help cover any services that you may need, which are not covered through the IHS program. And then here's also a fact sheet. This is a full page front and back fact sheet. It has the 10 essential health benefits, as well as a pre-enrollment checklist and contact information for BeWellNM. And it also has the IHS and QHP covered services comparison chart there on the back as well. All right. And this is our COVID-19 response flyer that we had done in collaboration with the state's Medicaid office. And so it does have an FPL chart here, as you can see. It shows how many individuals are in your household, as well as your monthly income amounts here. So it kind of just shows a breakdown to show, to provide a visual as to what individuals may qualify for during this time. And we're really trying to emphasize the fact that everyone qualifies for health coverage during this time. And so we strongly encourage individuals, if you have any questions at all, please give us a call or visit our website, BeWellNM.com. We also have a chat function available on our website at BeWellNM.com. If any individual visits our website, they can chat directly with the enrollment counselor at their convenience. And that COVID-19 response collaboration flyer has also been translated into Navajo. So again, this does have information on BeWellNM, as well as the New Mexico Medicaid program and the FPL chart as well. And again, all marketing pieces are available at our website at BeWellNM.com. For media, so we have completed approximately 15 radio interviews across the state as of April 30th, and this is an ongoing effort. We do have Native American specific publication ads that were placed in the Gallup Sun, Gallup Independent, as well as the Navajo Times and the Laguna Town Crier. We had released an op-ed by Teresa Gomez, who is a vice chair on our BeWellNM board of directors, and she's also chair of our Native American committee, and that ran in 3 publications, Indians.com, as well as the Isleta Pueblo newsletter and the Gallup Independent. Social media. So we launched our social media, or our Facebook page, BeWellNM for Native Americans was launched on March 1st. And we currently have over 500 likes as of now. And so if you are on Facebook, we would like you to go ahead and follow us at BeWellNM for Native Americans. We do provide a lot of information. We post fairly regularly on there as well. And we just provide information to individuals, specifically towards the Native American population here in New Mexico, on information on how to get enrolled or get questions answered directly from a Native American enrollment counselor. We also contracted with some Native American influencers on social media. So we have Tatanka Means and Matani Means, and who both have over 57,000 followers on Facebook combined. And so we're just really trying to get the word out to as many people as possible. We all know that the Native American population has been hit really, really hard with the COVID-19 pandemic. And so we're trying to reach as many people as possible to make sure that those that are uninsured know the routes, and we can actually provide them with those enrollment services from start to finish. Our enrollment counselors have all been provided information on how to conduct enrollments remotely, and also how to get the correct authorization forms and things of that sort. So that way we're able to follow up with our consumers to make sure that any premiums are getting paid, or if they need to send in, say, any additional documentation in regards to income or their tribal ID cards or anything like that, we are able to assist them from the application process from start to finish, as well as through plan selection. And so this has been a great campaign for us as well in getting connected with New Mexicans here in New Mexico. All right, so we're also available on Instagram at BeWellNM_official, and we do post regularly on our Instagram page as well. So if you're on Instagram, go give us a follow, please. And also on Twitter at NMHIX, for the New Mexico Health Insurance Exchange. And we do post fairly regularly on there as well. And we continue to monitor all of our social media platforms for any comments or any individual that just may have a simple question that we can just answer really quick in those comment sections as well. All right. And so also, BeWellNM for Native Americans hosted 3 Facebook Live discussions with board member Teresa Gomez. And so those Facebook Live discussions are available at our Facebook page, BeWellNM for Native Americans. And so they were aired on June 7th, June 16th, as well as June 25th. And again, we're just trying to really encourage folks to get enrolled in health insurance. If you're in between coverage at this time, we'll help you navigate to which coverage option is going to work best for you and your family, as well as get any and all questions answered. All right, so for our partnerships, okay. So if anybody is currently interested in becoming a certified enroller here in New Mexico, please reach out to us. We're really trying to reduce the uninsured in our state here in New Mexico. And so we're more than willing to set up an enrollment day for an enrollment counselor to come out and provide education and enrollment services. You can invite us to participate in any outreach opportunities in your community. I know with the COVID-19 pandemic, a lot of our outreach, our in-person outreach has been put on hold, but we have been utilizing our technology to the best of our abilities at this time to try to provide as much information out to the community or to the state as possible. So if you're interested in becoming an enroller, please send me an email at jyazi@nmpix.com. And I can help you get started and help you complete that whole process to become certified here in New Mexico. And so you can also join us for our next BeWellNM Native American Advisory Committee, so we can hear more from you. Again, our next meeting is scheduled for September 1st, 2020. Again, you can email me, jyazi@nmpix.com, to get more information or to participate in that upcoming advisory committee. And these are our current partnership locations. Due to the public health emergency, our online appointment scheduling tool is currently on hold. But if anybody wants to visit us on our website, BeWellNM.com, we can get you connected to either the closest enrollment counselor to you in your area, just to ensure that we're able to, in fact, complete those enrollments. So again, we've all been provided information on how to complete enrollments remotely at this time. And we have done quite a few during the pandemic. And so we've kind of got our ducks in a row here to get those enrollments completed and such. But these are our normal partnership locations where we typically set up on a monthly or bi-monthly basis. And so we are up in Farmington, Gallup, Dulce, Laguna, as well as Mescalero and Santa Fe. So if anybody's interested in becoming a partnership location as well, please send me an email, again, jyazi@nmpix.com, and we can work something out into getting an enrollment counselor available for your area. All right, and again, here are our partnership locations across the state. And so we are trying to expand this list quite more actually, to be more statewide. But as you can see, we are focused more on all of the northern areas where we have most of our northern pueblos, as well as the Navajo Nation, Hickory Apache Reservation, as well as down in Mescalero. And we can't forget the Rama as well as Alamo Navajo Nation area. So those are our current partnership locations. And again, we are working on expanding this list. So if you are interested in becoming one of our partners or having an enrollment counselor set up and just walk through any enrollments, or if any individuals do not qualify for Medicaid and may be interested in enrolling in the marketplace, please send them our way. We'll be more than happy to assist. All right, and that's all I have for today. So my contact information is here on the screen. So if you'd like, you can give me a call, send me a text message or an email. I'm very responsive. And our Director of Communication and Outreach, Maureen Manring, her contact information is available there as well.
Juliet, thank you so much for all of that information and for laying it out so nicely on your slide deck. I'm sure that people have a lot of food for thought. I mean, some of the best practices as you were going along that I noted were making sure to gather feedback from stakeholders, tailoring materials to American Indians and Alaska Natives, but also to certain groups within the larger group, like patients and tribal leaders, also sharing specific benefits for American Indians and Alaska Natives, so they know that this is something that they want to pay attention to and follow up on. And then also using multiple means to reach the people that you're trying to reach. And I really love that you focused in on social media as a really good tool, and using influencers and doing a Facebook Live event. So I'm sure that folks in our audience today got a lot of good ideas, and we really appreciate you sharing all of those with us. We're going to transition now to Amina. I'm sure Amina has some great things to share with us as well. So let's go ahead and open the floor to Amina. Welcome.
Ahanga Maheshi, thank you. This is Amina. Thank you, Carolyn, for the intro earlier, and you did well with my name, Amina Togli. And thank you to the National Indian Health Board for the opportunity to speak today and to share with other tribal benefit coordinators what we're doing here at Washoe to maintain our state Medicaid enrollment during this COVID event. And also am looking forward to hearing how other PBCs are managing during this time as well. Julia, your presentation was amazing. Okay.
Thank you so much, Amina.
Thank you. Just wanted to reiterate that the PBC roles are very important, especially right now during this time. Washoe is currently, we are also now dealing with our first COVID outbreak with multiple patients involved, and having the resources from our PBCs is critical for dealing with this pandemic, to making sure that our tribal members are getting the coverage that they need. Go ahead, next slide, please. That's just me from last year at our Elders Fun Day up in Meeks Bay. The next slide. So these next few slides here, I was just sharing with everyone the type of information that we were sending out to our community members. The resources that we're just using right now are through newsletter mailings, social media, and weekly updates are made at our council meetings. So these next few slides are just some samples of the material that we're sending out, just letting our tribal members know, that we're here still. Even though this COVID event is going on, there are some smaller, more rural tribal clinics that are closed or only open half days during this event. And we're just letting everybody know that we are here and that we can still help assist with Medicaid and SNAP, and that the resources are available there. So go ahead and next slide. Again, just more information reminding our tribal members their responsibility in maintaining their PRC status. We need them to help us help them. Go ahead, next slide. And then this is just part of our flyer that we made in-house that we give out to our benefit our patients, we have them around in our rooms and the hallways, and we have also mailed these out to our patients as well. Next slide. And that's just the other part of it. Go ahead, next slide. All right, so the processes during COVID events that we're doing here at Washoe is that we're letting our patients know that we can and we do assist them with our Nevada Medicaid SNAP applications as well as our Medi-Cal covered California application over the phone. A lot of our tribal members do not have access to a computer. They may not have a smartphone, or it's too much to do on their smartphone. So we assist them with the applications over the phone. We ask the questions, they give us the answers. We highlight where they need to sign their applications, and we arrange for them to come down to the clinic to sign the paperwork. And if we need current income information, we ask them to bring that with them as well. We do have runners at our clinic right now that we're screening patients. So we just alert them that a patient is coming to sign a medical application for us. And then once we have everything, we fax it over to our state offices and then just monitor for follow-up to make sure that we're getting that benefit put in place for them. We are implementing the same process on the renewals that we get for our patients. And if our patients that do have computer access and they are savvy, we can give them the website addresses, and then they are welcome to apply online for themselves. We just do ask them to make sure that they're adding us as authorized representatives, so that way we get copies of the mailing that the states are sending them. That way we can help them help us. Next slide, please. So the two states that we work with are both Nevada and California. For Nevada, we have a field worker. We maintain close contact with her. She's currently working from home. Most of the state workers are working from home right now. And so we keep contact with her either by phone or email, so we can ask her to check the statuses of our applications that we have faxed over. With Washoe Tribe, we are a cross-border tribe with Nevada and California. We have a reservation, Hangalauti, in Alpine County, located in Markleeville, California. Our tribal members there will have Medi-Cal or the managed care plans. And so we have a close relationship with the Alpine County Social Services worker there, and he assists us with the application process and updates with our patients there as well. Next slide, please. So the other services that we like to share that we do offer with our tribal members, with our elders, as they are coming into Medicare age and some with some disabilities. Not everyone that turns 65 receives information anymore that they need to apply for Medicare. There is that 7-month window timeline to apply, 3 months prior to their birth months, which is ideal, the month of their birth month, and 3 months after. So we try to keep an eye on the schedule, watching for patients that are 64, if they have upcoming appointments, and we reach out to them to see, if they have received anything, if they need assistance in applying for Medicare, and then we can assist them with that. We have a phone number for local SSA offices in Nevada and in California. And then most of the appointments during this time are being handled over the phones. If a patient is already receiving some sort of disability or early retirement, they may automatically receive information from Social Security welcoming them to Medicare, but we just like to monitor that to make sure that they're not missing their enrollment time, so they don't have any penalties. Next slide, please. Oh, my apologies. Also to share with the disability, I personally made a packet when I started in this position. I recreated one that Social Security previously had before they went switching up to their online services, because I know a lot of my tribal members, again, they don't have access to a computer. And so I have this packet I've made up for them. They have homework to do, and I'm advising them to do their research for their information that they need to do before they make their appointment. Usually they can get scheduled within 2 weeks. Depending on what their disabling conditions are, 2 weeks may not necessarily be enough time. So I always advise them to do their homework first, and then we can call and make that appointment for them. And then same thing as well, if they have access to a computer and they're familiar with it, they can also apply for their disability online as well. And then the last slide there, the teamwork equals success. Just reiterating what Raho had said initially in that coordinating of benefits. With us as benefit coordinators, along with our referrals and our fiscal intermediary department, and working together for monitoring patients' charts to ensure that they are complying with providing us the necessary documentation needed to maintain their PRC status. If we see that they're coming in within the next week for an appointment, we'll reach out to them and remind them, hey, we need this and that, and so to make sure that they're bringing in the documentation needed. Unfortunately, not all of our efforts are fruitful, but we just keep plugging away at it, and that's about it for me. Short and sweet. I'm so sorry. I just want to remind all of our patient benefit coordinators out there in Indian country to keep up the good work out there. It's really important that we do our best effort to try to get our tribal members enrolled in state benefit insurance. It helps them definitely in the long run. Thank you so much. Maliki Gabiki.
Thank you so much, Amina. I really loved your presentation, and I really just want to highlight a couple of things from it that really struck me. It sounds like working with a tribe and certain communities in the tribe, you're really looking at getting information out to people in the ways that they're going to best receive it. You did mention social media and council meetings and newspapers, but then you also said that a significant percentage of the population really needs to be reached by phone. And that's really important, like tailoring the means of communication to the group and making sure that the ways that you're communicating with them are really going to reach them. And then I also heard you talk about the close partnerships that you have with the community members and even giving them assignments. This is the homework so that they can do the pre-work, and then when they are meeting with you, then they have everything that they need, and making sure that you're translating that information for them, because it's very complicated and people aren't always familiar or comfortable. So it sounds like that's a really important piece of the work that you are doing. And then also, watching for those certain triggers, like if the person is 64, okay, that's someone that we want to make sure that we connect in with so that they don't get a penalty when they're enrolling in Medicare. So really, really loved your presentation. Thank you so much for sharing the ways that you're making your work really connected with community and meet them where they are. I think that that's just a very, very important thing to do. So now at this point, we have a few minutes left, and we want to open up the floor to questions from our audience. And we have Kristen Bitsui and also Dominique Covelli from NIHB staff that are going to pull questions out of the chat box and direct them to our presenters. So I will go ahead and turn it over to Kristen and Dominique.
Okay, so this is Kristen. So I saw one from Douglas, and he says, how is the Navajo Nation dealing with multi-state CMS systems? Kitty, you want to take this question?
Hi.
Kitty, are you still there?
Yeah, I'm here. What was
Okay.
the question again? I'm sorry.
The question is, how is the Navajo Nation dealing with multi-state CMS systems?
Well, I think the Navajo Nation has always been challenged because they need to deal with 4 state Medicaid agencies: Arizona, New Mexico, Colorado, and Utah. And so that's why several years ago now, CMS produced a report on the feasibility of the Navajo Nation becoming a Medicaid state agency. And what we found is that it would require appropriations and legislative fix. So I'm sure it's, continues to be challenging for Navajo during the COVID. Medicaid has provided flexibility to states, to all state Medicaid agencies, to help streamline the application process, to encourage presumptive eligibility, so that people can get enrolled in Medicaid. So, I think the Navajo Nation challenges are going to continue. So, yeah. Okay.
Thank you for that, Kitty.
Sure.
And he also had another question, and that question is, are each state utilizing the Affordable Care Act differently? I'll go ahead and take on that question there. So yes, each state do things differently depending on which platform they decided to utilize. There's the state-based marketplace, there's the state partnership marketplace, and then there's a federally facilitated marketplace. So depending on which platform your state has will depend on how they utilize the Affordable Care Act within their state. So the next question is, let's see, how do we become a certified enroller in Kansas? So thank you to Steve. It looks like he provided the link that CMS has for the certified application counselor. There is also some PowerPoints, some resources that is associated with that, and that link will take you directly to that. And I believe that there's certain states also, as BeWellNM had just informed us, that they do help their enrollment assisters in their state to become a certified application counselor also. So, and Kitty also shared that CMS invites new applicant organizations who want to become a certified application counselor designated organization for plan year 2021 to apply during CMS's open season running through August 31st, 2020. Kitty, would you like to add anything to that?
Sure. Yeah, CSIO has a program where you can apply to be a certified application counselor, and the email address or the website link that Steve provided, I think you can go there. There's an application that needs to be completed by August 31st, and they provide training as part of being a certified application counselor. So if those people who are interested, I would encourage you to go to that website link that Steve provided. Thanks.
Okay. Thank you, Kitty. So let's see. The next question is, I was going to ask the same questions about NA phone numbers or phone lists. I'm not too sure what NA is, but how does one go about obtaining a Native American phone list? Juliet, this might be actually from your presentation.
Okay, so the way we were able to access those phone numbers was through the voter registration information as well as United States Census information.
Okay, and then the next question is, are New Mexico Marketplace Health Plans contracted with the Indian Health Service?
Well, all Indian Health Service centers here in New Mexico do accept all qualified health plans, yes.
Okay, and the next question comes from Tony. Would your home health care facility, PRC/CHS, not cover your expenses above your health insurance if your respective health care facility be notified within the 72-hour window?
I'm sorry, is that directed towards me?
Yes.
Okay, so in most cases, contract health or patient benefits, the PRC, I'm sorry, will accept you within 72 hours, yes. But if you're in, say, a situation like I found myself in back in 2015, where I broke my ankle hiking at Sandia Crest, and unfortunately I wasn't able to get my information to IHS within 72 hours since I was in the hospital awaiting surgery and all that ongoing process. And so you would have the opportunity to call and get in touch with somebody just to let them know your situation, and then they can then get in touch with the hospital and try to receive your information that route. But yes, that is a possibility.
Okay, thank you, Juliet. Dominic, is there any other questions that you saw?
Let me just do one last scan. I think you answered the questions about certified application counselors. Several people asked, will we be able to get the slides from this presentation? And the answer is yes. It will probably take a few days to get them on the website, but they will be under NIHB's COVID-19 Resource Center. So I would recommend folks check that out probably by Monday. I think someone asked, when are the yearly exams? I assume that that's for the CAC.
Kitty, they're talking about the certified application counselor.
Right, and Steve Goldman, who's an Oklahoma navigator, has been very helpful. He answered that CMS exams are held in September. So all the CACs must renew with CMS. And that includes a roster list of CACs who will be taking exams. He did send a mailbox where people can send questions, CAC questions at cms.hhs.gov. That should be .gov, so.
Perfect. As some of you probably have noticed that Steve Goldman, he is from Oklahoma Navigator, and he's also a really good resource person. And I see that he also put down his email address on there too. So that's another individual that is pretty well known with the marketplace side of it too. So he's a good resource person for that. Any other questions, Dominique?
I think that is all I saw.
Got it. Okay, Carolyn, we're done with the questions and answers.
All right, and we have kind of hit our timing mark as well, which I was not sure we would be able to do. I want to thank all of our presenters, Kitty, Juliet, Amina. I know that Raho is off the phone now, but I want to just thank you very much for being with us and sharing all of that terrific information. I also want to acknowledge Kristen Bitsui from our staff. She has been kind of the mastermind who has coordinated all of these different pieces and worked on this presentation for National Indian Health Board. So Kristen, thank you so much for all of your good work and all of the great information that you shared with us. What we will do is we will make sure that we get all of these materials up on the NIHB website, and we will make sure that if there are questions that came up and that our materials have not provided answers to, we'll make sure that we post the answers in the follow-up on the website as well. And then I also just want to invite folks, if you have joined the webinar today and you have questions that you didn't get a chance to ask, but things that you still have questions about and would like to connect in with us or our presenters, please feel free to reach out to National Indian Health Board. We can help coordinate your questions coming forward to the presenters that would have the answers. And if we need to pull in other folks, we can always do that as well. But National Indian Health Board is here as your resource, and we want to make sure that we support you now and always. So I want to thank everyone for their participation today, and please stay safe and be well.
Thank you.
Thanks, everyone.
Thank you all as well.
This concludes today's webinar. Kristen, did you set aside time for the speakers to join afterwards, or is everybody going to disconnect now?
It looks like Kitty already disconnected, so yeah, we'll go ahead and just disconnect.
Okay, great. Well, thanks so much, everyone. We'll talk to you soon.
Kristen, did you want me to go ahead and stop the recording?
Yes, please. Thank you, Corey.
All right, thank you all. Have a great day.